The minority leader at the press briefing expressed disappointment in the president for his handling of the COVID-19 situation, casting doubt over the role of data and science in the decisions made so far.
Many professionals have observed that the data being published by the Ghana Health Service does not lend itself to meaningful analysis in the form it is presented. I mean, any of you who watches Euro News or Sky, even if you listen to the British health minister or holding forth prime minister in their brief, you can compare and make analysis out of the data made available than what is done in Ghana. What you are just told is 3,000 cases, recoveries and deaths. That is not sufficient for any thorough health analysis. We need to know how many persons are affected, and for our view as a minority, testing, tracing, monitoring and isolation should have been the order of the day from day one. The focus of this administration should have been on testing, monitoring, and where it is necessary, isolation. And therefore, we are disappointed at government's response to this matter.
He spoke about the limited number of PPEs for frontline health workers and its negative impact on the fight against the pandemic.
Our healthcare workers cannot face the weeks ahead unequipped and unprotected. Personal protection equipment must be made available adequately and in sufficient quantities across the country to all health professionals in order that we'll get this process going. I do not intend to respond to the health minister's statement that they are being stolen. He knows people who steal, what should happen to them, and he should invoke the law and let those persons face the full rigors of the law. We cannot at this time be interested in making money out of PPEs donated. So that's why an audit becomes an imperative for us to understand what quantities were acquired, what quantities were sent to which hospital, which region, which district, at what time.
The minority then asked government to evacuate citizens stranded in other countries.
As a minority, we are concerned about the plight of Ghanaians who appear stranded in other jurisdictions following the closure of their borders. Indeed, this morning I got a call from some Ghanaians in Nigeria who have been locked down and even ready to come at their own cost. And therefore, the foreign ministry, even as countries have locked down, it's practically impossible to be able to do it. But many other countries are evacuating their citizens. India have done it, South Africa have done it, the UK, the US have done it. Probably his resilient economy cannot evacuate Ghanaian citizens abroad, probably. That is why he may not be able to venture into that enterprise. It is our considered view that just as our government is able to open our airports despite the closures for foreign nationals to be evacuated out of Ghana, government should do same by providing a narrow opportunity under strict evacuation protocols of screening, testing, and quarantine where necessary in order to secure and safeguard the lives of Ghanaians abroad. The minority urges government to ensure a high level of accountability and transparency in this enterprise.
So the minority just delivered its own reflections and its diagnosis and reading of the situation with regards to COVID-19 in the country. Reporting for Citi News from the administration block here in Parliament, my name is Duke Mensopoko.